Today is World Mental Health Day, and while the pandemic, as we know, led so many people to seek help, it's always a good idea to check in on your family members to see how they're doing, do a well-being check.
Right, and more than a third of high school students dealt with poor mental health during the pandemic. But the CDC says 44% still felt persistently sad or hopeless in the past year. Dr. Gabrielle Roberts is a pediatric psychologist with Advocate Children's Hospital. Thank you so much for joining us. Doctor, it can be hard sometimes for parents to talk with their teenager, but first you say be patient and don't expect a long conversation.
And you know firsthand, right?
I do, yeah, I do.
Yes, I mean, you might be able to expect a long conversation depending on your child, but the important thing is that you're trying, that you're opening up the lines of communication, and short conversations can still provide support and a lot of good information.
Dr. Roberts, it's a challenge for parents to determine is something just a phase, are they going through this, or is something deeper happening? So parents need to be persistent, right? And as hard as it is to get the timing right of when to talk to your teenagers.
There's many people would say there is no right time, but exactly. I mean, the right time really depends on and varies for children and families. But you're right. I mean, if you do have a concern that there really is something wrong, you do need to be persistent for the sake of their well-being and safety. If you're just more concerned about making sure you want to know what's going on with them and you want to make sure that you're checking in, try out different times. You know, waking up a teenager out of bed first thing in the morning is probably not going to get you your best result. Try a time when you're calm, they're calm. You might even consider asking them what a good time would be, and you may at least learn when a bad time might be or when the worst time might be.
You know, we've heard people say when you see something, say something. It's usually about crime, but it's good, you say, to give teens a concrete example of what you're concerned about. And also, what are some signs that something may be beyond a typical, let's say, teenage phase?
Yes, I think a really nice way to try to communicate your concerns, especially if you're not getting, you know, answers to your questions that feel like you're really hitting it, is to make observations. You know, I noticed that you became quiet when I asked about how things went with your friends at the mall yesterday. The mall, now I'm aging myself. Well, you know what I mean. But, you know, just checking in. And, you know, if you notice that they're withdrawing, if you notice that they seem different from themselves, I mean, the biggest thing is when your child is not acting like your child, that's when you really, maybe there's cause for greater concern. And maybe it's nothing. Maybe it's just an off week or an off couple weeks or an off day. But when they're not acting like themselves, if they're withdrawing, if they seem sad, if they seem more irritable or angry, or you notice that they're not playing or hanging out with their peers or playing video games like they generally do, or, you know, they're pulling away from their normal activities.
Dr. Roberts, before we let you go, we know the isolation of the pandemic was devastating for so many kids, but what about social media? What are the lingering impacts of that on our mental health, certainly with young people?
How much time do you have? I'd say that's a bigger question. I think the lingering impacts are varied. I think that we found that social media connected us in a way that we would not have been able to be connected had the internet not existed during the pandemic. And so there were some positives, and there were some positives for children who generally are more socially anxious and had a more difficult time connecting in person. But there is a lingering effect of maybe over-reliance on social media, and we're maybe still spending too much time on social media. And so I think that one thing that children and teens and parents can all be working on is just sort of adding more back into their daily diet of activities. And it doesn't mean we have to cut it off completely, but we want to make sure that we're also engaging with people, talking to people in person, getting fresh air, getting exercise, getting good sleep, all those things.
Okay, pediatric psychologist Dr. Gabrielle Roberts, thank you so much for your advice, for being here to help our teens ultimately in the long run. Thank you.
Thanks for having me.